Hey guys, this is Teresa with Right Way. I am doing a video today to show you guys how you're going to draw up your medications that you get from Boudreaux's Pharmacy, because there's been just a little bit of confusion there. So what you're going to get in the mail is this cooler box, but it's going to come inside of a cardboard box. But once you take it out of that cardboard box, it's going to look exactly like this. So I'm just going to walk through the unboxing of that today and just kind of show you how you would pull up certain doses of the medications. So when you get this is what all comes inside of it. This is where your medication is, and this is going to have your syringes and alcohol prep pads, and then you have your ice pack there. Now, if you get your medication and it is hot or warm or generally just not cool, call the clinic immediately and let us know. We don't want you using hot medication. But if you get it and everything's fine, then keep everything that comes inside this cooler box. This is where your instructions on how to pull up your medication is going to be. Some people's instruction sticker is on the outside of this bubble wrap, but usually it should be inside of the bubble wrap on the black bag that has your vial in it. So I'm just going to show you where you can find that information. So like I said, some people's is on the outside of the bubble wrap. Don't throw anything away until you're confident on how to pull your medicine up. But typically, generally, this is what it's going to look like. It's going to have all of your information here. You're just going to want to verify that all of that is correct. Date of birth, all of those things. And then here on the instructions, it says inject 75 units subcutaneously weekly for 4 weeks. Now, I am fictitiously on 15 milligrams. So nowhere on here does it say 15. It just says 75 units. Your milligram dosage and the number of units that you draw up will not match. They will not match. So if it says 75, you're going to draw up 75. Like I said, for this, 75 is equivalent to 15. So you're going to open your little packet that has all your things in it. You have all of your syringes here, and then also your alcohol prep pads. Okay, so to draw up this first one, I'm not using gloves because you're not going to use gloves when you draw up your own medication. So we'll get an alcohol prep pad, we'll clean the top off just a little there, and we will get our syringe, and you're just going to want to insert the syringe right here in the center of this circle on your vial, just right there. Flip it up to make sure that that liquid is right where it needs to be, and then you'll just slowly start drawing up to the 75 units. So you can kind of see maybe where a bubble is forming right there at the top. Don't worry about that. We'll get that out when we're done pulling up all of our medicine. So just nice and slow all the way to 75 right there. Okay, you do not have to be exact for 75. Just go in between the 70 and the 80 on the syringe. There are the little notches here that will tell you 71, 72, 73, 74, 75, but like I said, you can just eyeball it and go between the 70 and the 80. Okay, so we've got our 75 units. So if you can see that little bubble hanging out right there, we just want to tap that out. You're just gonna thump it a couple times, let that bubble get all the way to the top, and you're gonna push just barely until a full bead of medication comes out the top of the needle there, and then you're ready to inject. If you're not on the 15 milligram tirzepatide, I'm gonna go through a couple of other dosaging options, one for the semaglutide and then another lower tirzepatide option. So if you're on, this is gonna be if you're on the 0.5 milligrams of the semaglutide, which is the second dose of your semaglutide. Again, you're just gonna clean the top of that vial there with your alcohol prep pads that come in your kit. And for these, you're most likely going to get a 30 unit syringe. And so for 0.5, you're going to draw up 12.5 units on the syringe. So again, we're just going to inject right in that center circle there. Turn it up, and then 12.5 nice and slow. So there we go, past the 5. and then 10, 11, 12, right there. Again, 12.5 is going to be in between the 10 and the 15, so you can just go right in the middle of those, the same way that we did on the 15 milligram going to 75. So the 12.5, and again, same as before. If you have a trapped bubble and want to get it out, you do not have to. It's not going to pose any threat. You're just going to tap a couple times to get all that air at the top of your syringe, and then just push until you have a solid bead of medication come out the tip of the needle. Just like that, and then you're ready to inject. Now I'm going to do the tirzepatide 10 milligram. Again, remember your milligram dosage is not equivalent to your units that you're going to draw up. So if you are on 10 milligrams of tirzepatide, you are not going to pull up 10 units. You're going to pull up 50 units. So again, going right in the center of this circle here, just going to puncture right there in the middle. Turn it up, and this is a 50 unit syringe, so you're going to fill up the whole syringe there. Just pull in nice and slow until we get all the way to the end at the 50. So this is what your syringe is going to look like if you're on 10 milligrams of tirzepatide. Again, your milligram dosage that you are on is not equivalent to the units that you're going to pull up. So this is a 10 milligram tirzepatide injection filled all the way to the 50 on the syringe. Okay, just to remind you guys, do not throw anything away that comes in your styrofoam box until you are fully confident on how many units you are supposed to draw up. Remember that your milligram dosage and your units are not the same. And of course, if you ever have any questions or concerns about your medication, feel free to give our clinic a call, or you can always stop by and we would love to give you a demonstration.